following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to episode 21 of Ask the Behavior Doctors. My name is Dr. Jacob Boney. I'm the owner and clinical director of Scottsdale Pediatric Behavioral Services. We're here in Scottsdale, Arizona today, answering your questions, concerns, and interests about ABA. So today's question has to do with, Dr. Jacob, what should I look for when trying to find an ABA provider? Since you convinced me that an ABA is safe for my kid, I want to know what kinds of indicators to look for to determine if an ABA provider is high quality or not. All right, so I don't know the scene where you're at in your town, but here in Phoenix, there are a lot of providers, a lot of different options. I mean, no joke, the average family has at least 20 to 30 places to choose from around here. It's really hard to sift through. It's really hard to know what you're looking for. It's really hard to know what's gonna work, what's not. So I wanted to come up with a list of things for you guys to kind of a checklist to go through to see if you think the provider is gonna be a good fit for you or not. So experience, how many years of experience, what kind of patients do they see, what's their specialty, what have they done? What was their training like? Does their experience and expertise align with the profile that your child presents? So remember, I already talked about how ABA has had a recent major influx of growth. So there's a lot of new providers out there. There's some very competent new providers. I do not want to badmouth all new providers, but I will tell you this, that experience is critical. So I would personally look for someone with at least 3 to 5 years of experience. I think a lot of new people should probably just go work under someone for a little bit, get some more experience. But as a parent, I would probably look for someone with 3 to 5 years of licensed experience, someone whose typical patient or typical patient experience replicates what your child presents, and someone who really seems to be knowledgeable about your child's behaviors, their issues, and someone with a lot of experience treating those specific types of issues. The supervisors. So the way an ABA place works is that the lead people are BCBAs, Board Certified Behavior Analysts. Typically under those BCBAs might be BCABAs, Board Certified Associate Behavior Analysts, or what's called just behavior technicians or registered behavior technicians. So you typically have that hierarchy. And parents, I want you to know how involved the supervisor is going to be with your child's case. Here at our practice, at Scottsdale Pediatric, we have a requirement that all cases have 2 supervisors. We have a primary and a secondary. We feel like that really leads to a much higher quality of care. We also feel like that leads to professional collaboration on all of our patient cases, which our patients really seem to appreciate. So you're gonna wanna ask, how many supervisors is my child gonna have? Who's the primary supervisor going to be? How much experience does that primary supervisor have? How frequently am I going to hear from or talk to that primary supervisor? Are they going to be available to me? Are they going to be able to answer questions? Am I going to feel connected to them and like they understand and really are in tune with my child's case? What you don't want is you don't want a lot of supervisor turnover. You don't want to have different supervisors all of the time. You want to have a supervisor with experience and someone that's going to have that frequent contact with you and frequent contact with your child's case. The direct care staff. So obviously the way it typically works is that insurance companies will pay what's called a registered behavior technician to do much of the direct service with your child, and then they'll pay the BCBA to supervise or oversee the case. So you really want to figure out about the quality of the direct care staff. So here at Scottsdale Pediatric, I require that all of my direct care staff be college educated. I require that they all have minimum 2 years of experience. I require that all of my new technicians become registered behavior technicians and get that certification through the Behavior Analyst Certification Board. I require that they work full-time. I don't hire part-timers. I don't think you can be an excellent professional at this job part-time. So that's our standards. You're really going to want to ask, what's the training like for the direct care staff? How many years of experience do they have? What are they required to do for ongoing training? How are they going to get supervised and overseen on your child's case? You want to ask how much they're paid. Honestly, parents, and let me tell you, especially here in Phoenix, the average pay rate for a behavior technician is somewhere between $11 and $16 an hour. I mean, towards that lower end, they're getting paid what McDonald's workers are getting paid. I would personally not want that in my house. Your child's treatment is much too important for that. I would ask what they're getting paid, and I think, obviously the more they're getting paid, the more professional they're going to be able to make the job. Also, the more they're going to be able to sustain it as a career. Think about it. If they're making super low pay, that's probably going to be a part-time job or a very temporary job for them. They should be getting paid enough to make a sustainable living in your area. And if they're not, you might want to look for an agency or for a provider that is paying their direct care staff that much, so that you can feel confident that your child's going to have a consistent, professional, well-compensated therapist that's probably going to have a lot of stability in their position. You're also going to want to ask about turnover rate, or say, hey, how many employees typically come in and out of this place every year? How long does your average therapist stay? For us, we really want to get that number minimum to about 2 years, preferably up to 5 years. You want the average therapist to stay at least a year. If the turnover is worse than once a year, that's probably going to be a major red flag. The website. You want to look at a company's website. A website is a great marketing tool, but a website should be useful for patients. A website should be a resource for you to get information, to feel informed, to feel connected to the staff, to really just be made aware of the company's vision, of their mission, of their values. I think a website is a very serious investment for a business, and is something that is essential. That would be a major red flag to me if I was going to a provider who did not have a website as a resource for me as a patient. I think companies should invest, at least reasonably into their website to provide patients with basic information. I also think that company should update that website as frequently as they can to provide those updated resources to patients. Remember, you should feel like your provider is a true resource to you and your child. You should feel like you're getting frequent updates and information from that provider, and you should feel like that provider is really staying abreast of current issues, of current topics, and staying, on the mission of informing you as a patient. Availability, especially when first meeting. How available is the supervisor? Are they willing to meet with you and give you a tour for free? Every single patient I have come in here, I would never charge for a tour of our facility. I don't want parents to feel pressure to sign on with us. I want them to feel comfortable and confident with that choice. Anybody that puts pressure on you to pay a fee or to sign on the dotted line before they'll meet you, that is a major red flag. You should be able to meet any provider, go take a tour of the facility at absolutely no cost to you. If you have to wait in line, fill out a packet, and do all kinds of hoops before even meeting or talking to someone, that's not a good indicator that they're going to be available after you're a patient. So really kind of gauge that availability, see if they'll answer your questions, see if they'll kind of explain to you a typical course of treatment, see if they'll obviously give you a tour of their facility. I mean, they should be able to sit down and make you feel really confident and comfortable, not only of their process, but let you know kind of how that progression will take and what to expect from treatment. Expertise. You should feel like your provider is an expert, not only in behavioral science, but in your child and in your child's needs. When I say an expert, do you feel like they're able to be knowledgeable and aware of all the issues that you have questions about? Do you feel like they're able to provide you with reasonable explanations? Do you feel like they're able to educate you on essential information? Do you feel like they're updating you about frequent issues about your child or about just current topics or current trends? Do you feel like your provider is a true expert? If you don't feel like they're an expert, why would you pay all of that money to go bring your child to that person? So parents, I definitely think you need to feel like your provider is that expert that can provide you with that essential information. Data. The data that they take on your child is critical. That's how they make decisions. That's how they guide your child's treatment. They should keep constant track of data. So here at our practice at Scottsdale PBS, we have a full-time data person who's 40 hours a week keeps track of our data within 24 hours of service delivery. So any parent can call us anytime and get their data digitally emailed to them in an instant. They can know exactly what programs, what targets, what kind of things their child is working on. They can provide feedback, or they can schedule a meeting with us, and we could meet with any parent within 48 hours. So your provider should keep constant, updated track of that data. They should be using that data to make decisions. They should also have what's called a decision protocol. I've talked about that in a previous video. A decision protocol is a very established, delineated process for making quick and efficient decisions about your child's data. If they don't have that, again, you should ask about that and ask that they develop one, at least for your child. Options. So I tell every patient every time we meet, we have nothing but options. We can provide treatment in multiple places. We can provide treatment in multiple ways. There should be no box or no one way that treatment has to go. If your provider is telling you that you have to do it this certain way, or that they're only able to provide it one way, that's a major red flag. That's probably most likely to their benefit, not to yours. A really skilled, talented provider can be flexible because they can utilize the whole science of ABA to treat your child's needs. Remember, our job is to be effective and to do what's in the benefit of the patient, not what's in our benefit. So parents, ask what kind of options there are for treatment. Ask if there are options about how, when, and why treatment is provided. You want to have a provider that's able to flex with you, able to use different techniques, different strategies, able to do whatever is necessary to be effective for your child. Remember, don't go into a place that's telling you there's only one way to do it. It has to go this sequence. We can't flex, we can't change. You have to fit in this box. That's not going to work for you long term. Facility. Do they have a clinic to conduct treatment with your child? I think a facility is important for several reasons. Number one, our facility is our greatest asset for training our staff. Staff want a nice facility to work in. Staff also need to be frequently trained and met with. If there's not a facility, that training is really hard to do. Also, number two, children need a safe, controlled environment to receive treatment a lot of times. In the home is great, it really is. However, children can have significant learning histories in the home. Also, number two, you don't have a supervisor available typically directly in the home. A clinic, you can have a team of supervisors constantly available to staff to oversee, supervise, and monitor implementation of a case. Again, there's a lot of good professional ethical reasons why providers should pay money to have a nice facility to provide that treatment for your child. If the provider doesn't have a facility, you might want to ask when they do plan on getting a facility, or if they plan on getting a facility. And if they don't have a facility, you're going to have to ask yourself, how important is that to you? I will tell you, the best quality providers I know of and I've worked with will invest money in having a clean, nice, comfortable facility to train their staff and to conduct treatment with your child in. Acceptance rate. You're going to want to know how many patients the provider accepts. Some providers, and let me just tell you my opinion, some providers take every insurance company imaginable. They will intake every kind of patient you can think of, and it's kind of run like a puppy mill, unfortunately. And just the business sense of this, sometimes patients or agencies, they need a really high volume of therapy to make up for loss in profit margin. So what they'll do is they'll just intake, and then they'll make patients wait, or they'll make patients wait for them to get a direct care provider for them. You want to know about acceptance rate. Honestly, high quality providers typically should get to the point where they're only able to accept maybe 30 to 40% of the patients that pursue services with them. If they're accepting anybody and everybody, every kind of insurance, and it seems like they're just volume based, that's going to be a major red flag for you parents. You want your agency or your provider to see the patients they want to see, not the patients they have to see. Your agency needs to be able to turn away patients that don't fit their strengths or their ability to provide services. You need to be with an agency that will accept patients because it's in the patient's best interest, not in the business's best interest. Reputation. You should ask around. You should ask parents. You should get on Facebook, social media, look for some parenting groups that have to do with like ABA treatment in the city that you're in. Get an opinion. Ask around, say, who has a really good reputation? Who's one of the better providers around my area? Who is really doing effective treatment with kids around? I mean, the best thing is that you can hear that maybe 10 or 20 providers have a great reputation in your area. I will tell you, the best providers create a reputation. The best providers have good momentum. The best providers typically are going to have some kind of screening process. The best providers are going to be picky about who they take. So parents, you want to ask about that reputation. What are people saying about them? Do they have a great track record? Are they getting good results with the patients that they're treating? Those are all things you're going to want to know. The last thing I think that's really important when selecting a provider, parents, is that comfort and connection that you feel. I cannot emphasize this enough. If your child's receiving 40 hours of treatment a week, think about having someone in your most private, intimate space, your home, for that many hours, a month or a week. Think about that connection. I mean, you are literally trusting this provider with your most precious asset, your child. You have to trust that person and you have to feel comfortable, totally confident that they are competent and capable of giving your child the best treatment they can get. If you don't feel that from the beginning, and if you don't consistently feel like the provider is trying to give you that sense, don't go there, parents. You have to feel comfortable and connected. You have to trust your provider. You have to feel that your provider is competent. You have to feel like your provider cares about you and your child. And you have to feel like the only thing that matters to that provider is that your child makes progress. If you feel like other things are the priority and you don't feel that comfort and connection, again, I advise you look for another provider, because that has to be there. Because think about it, you're probably going to be with this provider for at least a year, maybe 2, 3, 5 years. That requires a significant amount of trust and that feeling of comfort and connection. So parents, that brings us to the end of today. I want to thank you for joining us. I want to encourage you to please continue to submit those questions to us at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale of philipcarnevalephotography.com. We want to thank you again for submitting those questions and for joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.